Hello, everyone, and good afternoon, good evening, good morning, or even good night to those of you joining us from all the corners of the world. Thank you for joining us today. My name is Armando Urban, and I'm a member of the education team at the International Testing Agency. It is my pleasure to welcome you to the 11th ITA Monthly Educational Webinar of 2022. As we approach the end of the year, it's important that athletes and athlete support personnel understand what is new in anti-doping in 2023. But before I introduce the topic and our panelists for today, please allow me to do some housekeeping. We are delivering this webinar in 5 languages. On your Zoom menu, see a button called Interpretation. By clicking on this icon, you can select a channel with your preferred language. I will be presenting this session in English, but you can also listen to the audio in Arabic, French, Russian, or Spanish. For those following us closely, you will note that I'm not the advertised host. Unfortunately, my colleague Mary is unable to join us today, but I'm happy to step in as we cover one of my favorite topics. Today's webinar is part of our educational monthly series that are available and designed to tackle key anti-doping topics and to raise clean sport awareness. As always, it is my pleasure to give a shout out to our official presenting partner, Inform Sport. Their investment allows us to deliver the webinar program free of charge in 5 different languages. Inform Sport is a global certification program for supplements that tests products for substances prohibited in sport. As supplement contamination continues to be one of the leading causes of inadvertent doping, we encourage athletes and athlete support personnel to check all products before using them. And you can do this at sport.wetestYouTrust.com. The ITA is proud to be recognized by UNESCO as leading international organization for the delivery of anti-doping programs. And this educational webinar is delivered with the support of the UNESCO International Convention Against Doping in Sport. As for all of our session, it goes without saying that we encourage debate, we encourage interaction, and of course your questions. But we do not support any kind of aggressive, abusive, or racist language. I trust you will join us with the spirit of fairness, respect, and integrity. And some other housekeeping points. Please do use the chat function to tell us your name, where you are from, your role, and your sport. And I can see many of you already using the chat. And so let me do a quick pause for a moment to give a few shout outs. Welcome to our friends from Sweden, Austria, Malaysia, Mexico, Denmark, and so many more. Also, a reminder that you can use the Q&A function to ask a question on this topic to one of our expert panelists. And we will leave some time at the end for this. Finally, note that we record all of our webinars so that we can make them available on our website and YouTube channel for those who are not able to attend the live session. So, on today's topic, and an extremely important one, where we will look at what's new in anti-doping in 2023, namely changes to the International Standard for Testing and Investigation, or ISTI for short, changes to the International Standard for Therapeutic Use Exemptions, or ISTUE, and the key modifications to the Prohibited List, which come into force on 1st of January. We will look at this from an athlete's point of view, of course, and we will break down this concept as much as possible for you so you can complement all of this information for you. So without further ado, I would like to invite the panelists to turn on their cameras and offer them a warm welcome. First, I would like to introduce Mark Stuart. Mark Stuart is the ITA Operations Development Senior Manager at the ITA. Importantly, for today's subject, he's also a sports pharmacist, and he has a wealth of experience in the area of drugs in sports, as he has led the pharmacy operations at over 16 Olympic, Paralympic, Commonwealth, and European Games, including the head of pharmacy for the London 2012 Olympic and Paralympic Games. Mark is also currently the director of the IOC Drugs in Sport program, and advises the International Olympic Committee on the delivery of pharmacy services for the Olympic Games. Mark, welcome to this webinar, and thank you for joining us.
Thank you very much, Armando.
Next, I would like to introduce David Healy. David is WADA's Medical, Science, and Medicine Manager and has been working at WADA for over 4 years. He was part of the 2022 ISTUE drafting team and was WADA's international lead on this year's revision. Prior to this, he worked as a sport pharmacist as well as a number of international events, including the Rio 2016 Olympic Games, the 2017 Asian Indoor and Martial Arts Games, and the 2019 World Indoor Athletics Championships. Welcome, David. We're looking forward to hearing from you, and I will say good morning to you in Canada, and thank you so much for joining us.
Thank you very much, Armando, and welcome to everybody joining us today.
Thank you, David. And as we mentioned earlier, we will leave some time at the end of the session for questions and answers. So if you want to ask Mark and David anything related to today's topic, please write in the Q&A box at any time during the webinar. During the webinar, you will also see a couple of questions pop up on your screen. So please note that your answers will be totally anonymous. So first up, we have the International Standard for Testing and Investigation, the ISTI, and I will spend a few moments discussing this. This is a technical document, and athletes should not be fully concerned with its details. But what is important for athletes to know is that it establishes mandatory standards for test distribution planning. And I hope you understood what I just said. But in other words, this ensures that no matter what sport you are in or what country you are in, as an athlete, you can be confident that athlete testing should be conducted the same way and to the same standard each time. This includes everything from the athlete notification process, sample collection, to the transport of the samples to laboratories for analysis. If we now consider investigations, it says also mandatory standards for the gathering, assessing, and use of anti-doping intelligence by anti-doping organizations, but it also ensures that this is done in an efficient and effective way. In terms of changes that athletes and athlete support personnel will find most interesting and relevant, this can be summarized as follows. Dry blood spot sample is now referenced as a type of sample collection in addition to urine and blood. This is a new type, as you know, of sample collection where an athlete only provides a drop of blood. Now, if you are not familiar with the next term, which is whereabouts, it is information provided by a limited number of top athletes about their location. And this, of course, supports the out-of-competition testing. Now, with updates, there is a greater clarity on the term whereabouts filing. So it's clear that this applies only to athletes in a registered testing pool. So no change in practice, but the update makes it easier to understand that only athletes in a registered testing pool and not athletes in other testing pool could face an anti-doping rule violation associated with whereabouts failures. Next up, we have sport gender. From 2023, it will be clarified that sport gender of the athlete shall be recorded on the relevant documentation. And finally, we can consider all athletes who are minors. These athletes are those who are under 18 and have additional rights when it comes to sample collection process. So for the next year, the Annex B of the ISTI has been revised to reflect the ITSI, has been revised to reflect the importance of safeguarding minors during this process. There is now a requirement that at least 2 sample collection personnel are assigned to a sample collection session involving a minor. In summary, these are some useful points to be aware of. And now we will now switch to the prohibited list and spend longer on this topic as a key focus point for athletes. And for this part of the webinar, I would like to welcome back my colleague, Mark, to take us through the changes for the next year and to give us a short reminder about what the list is and the importance of this list for the athletes. Over to you, Mark, and welcome back.
Thank you very much, Armando. Thank you for the introduction. As you mentioned, today I'm going to give an overview of the list of prohibited substances and methods, and especially some of the new changes that will come into effect on the 1st of January next year. The list of prohibited substances is the international standard published by the World Anti-Doping Agency that defines which substances and methods are banned in sport. The most important thing is to remember that the list exists and where to find it. But as an athlete or athlete support personnel, it is also very important that you're familiar with what's on the list and that you know how to check whether the medication you plan to take is prohibited or permitted in the sports you compete in. The list is a constantly evolving document and updated at least annually. WADA publishes the version for the upcoming year by the 1st of October, and this comes into effect on the 1st of January. Occasionally, changes are made mid-year, so if you need to take a new decision about whether to take a medicine, always refer to the WADA website for the current list, so that you're basing that decision on the current rules. The next slide, thanks. So how does a substance get onto the list? Well, a new substance or method can be added if it is deemed to meet 2 of the following 3 criteria. So firstly, it has the potential to enhance sport performance. For example, that they can make the athlete run, swim, or compete faster, or for longer, or lift heavier weights, or feel less pain so they can push themselves a little harder. Secondly, that the substance or method represents a health risk to the athlete. And many of the drugs fall into this category based on some of the serious side effects that they have, or their impact on health. For example, anabolic steroids can have serious cardiac side effects, which can result in an increased risk of heart attack. And some of the narcotic drugs, such as heroin or fentanyl, have serious risks of addiction. And marijuana use obviously has a widely documented health risks for users. Lastly, that the use of the substance or method violates the spirit of sport. Now, the spirit of sport really covers many concepts, but in essence, is the values relating to ethics and fair play and honesty. And I always say that if something is being used with the intention to cheat, then it's probably going to be against the spirit of sport. Substances or methods can be either prohibited at all times or prohibited only at certain times. Prohibited at all times means every day of the year, 24 hours a day. And the substances in this category include non-approved substances. Now, these are those substances with no current approval for human use, such as drugs under clinical development or designer drugs, or things that are only used for veterinary use. There's anabolic agents, and this is things like testosterone or clenbuterol. These are used to increase muscle strength and mass, and these may be advantageous in sports involving strength. There's peptide hormones and growth factors such as EPO or erythropoietin. Now, some of these are used for medical conditions, but might be abused in sport to improve endurance or strength. There's the beta-2 agonist category. Now, these are contained in many common asthma medications, and athletes with asthma must be particularly aware of this category, and sometimes a TUE is needed for these. David will cover that a little bit later. There's hormone and metabolic modulators, and this covers a wide range of substances, including some medicines such as insulin. And athletes with diabetes may need insulin on a daily basis. So again, a TUE may be needed for these drugs. And then there's diuretics and masking agents. An example of this would be furosemide. Now, these are used medically for the treatment of conditions such as blood pressure. Then we have the prohibited then we have prohibited methods, which includes blood transfusions and intravenous infusions in certain situations. Next slide. And the next section. This covers drugs prohibited only during the competition time. And this is usually from midnight, the night before the event, until the end of the doping control process. Now, these include stimulants, such as ephedrine, pseudoephedrine, Now, this is a particular category that catches athletes out, as many of these are found in over-the-counter medicines for coughs and colds and runny nose. There's also some ADHD medications in this section. There's a narcotics, and examples might be morphine or some other strong pain relievers. Now, athletes may need these after a serious injury in an emergency setting, and if they are used, a retroactive TUE would need to be applied for. And again, David will cover this a little later. There's cannabinoids, as I've mentioned, there's documented health risks associated with their use, and glucocorticoids. These are sometimes used for the treatment of sports injuries, such as inflammation of joints. Next slide. The list of substances is harmonized across all sports, but there's one section where sport-specific rules apply. And this is the section that talks about beta blockers. Now, this category of drugs can act to reduce tremor, and so may be advantageous in sports that require a steady hand. And for this reason, they're banned in the sports you can see on the screen. So in brief summary, before we move on, I just wanted to reiterate some key points regarding the list. First of all, there's common medications on the list that are banned, including antihypertensives, insulins, glucocorticoids for inflammation, ADHD medication, diuretics. But if these are used for legitimate medical conditions, athletes can apply for an exemption to take them. The rules are very clear on the list. The consequences are very tough and potentially career-changing if you test positive for one of these banned drugs. So athletes really need to take this seriously. Next slide. So you'll be pleased to know that there's a lot of resources out there to help you determine whether a drug is banned or not. And one of the best sources, in my opinion, is globaldrug.com. Now, if you live in Canada, UK, USA, Switzerland, Japan, Australia, or New Zealand, you can search for the brand names of medicines in your countries. But if you live in any other country, you can still look up the status of an ingredient and also find links to other international websites for information specific to your country. So I'd really encourage all athletes and their support personnel to check this site out if you haven't already. Secondly, ask your doctor or pharmacist. They are the experts in medicines and can help you interpret the WADA list. And many national anti-doping agencies also have athlete advice lines with experts to help you with your questions about the medicines in your particular country. Now, the most important thing I want to present today is the new changes for 2023. These are the changes to the prohibited list that will come into effect on the 1st of January next year. Let's start with the category of anabolic agents. The first change to note in this section is the addition of ractopamine. Now, this is a substance used as an animal feed additive. It's used as a growth promoter in farmed animals to increase meat production. Now, this is banned in farming in around 160 countries, but it is still used in others. When this is taken directly by humans, it may have anabolic properties, and this is why it's banned by WADA. But there's also potentially serious health risks if taken directly by humans, including cardiovascular effects such as high blood pressure. Now, at this point, I must say that it's very unlikely that an athlete would test positive after eating meat for this drug. In many of the countries that still use this in farming, the use is often strictly regulated to very low levels, which are unlikely to be detected in humans at all. Now, in the rare event that an athlete does test positive, they may be required to demonstrate that this was a result of meat contamination. Now, this would be done during the results management process. WADA publishes some very good guidelines that anti-doping organizations can refer to regarding how to manage potential positive tests due to meat contamination. Next slide. So other new listings in the anabolic agents category are adrenosterone. Now, some other names for this substance are also printed there on the screen. This is a steroid hormone, and if taken in high amounts, it may promote muscle growth, which is why it's banned. And epistane. Again, its chemical name is shown on the screen. This is sometimes promoted for weight loss and to promote lean muscle. Now, both of these substances are found in some dietary supplements, and there's a few examples pictured up there on the screen, but there's many more. Now really is the time to check all of the supplements you're taking to see if they contain these particular substances. Also newly listed in the anabolic section are S23 and YK11. Now these are additional examples of SARMs, which have a similar action to anabolic steroids. These are sold online and promoted for bodybuilding. And once again, these are sold as supplements. So please check everything you are taking now for these particular compounds. New in the hormone and metabolic modulator section of the list is apitegromab. Now this is added as an example of a myostatin precursor. Now this is a drug presently under clinical development in trials for a condition called spinal muscular atrophy. This is a condition that makes muscles weaker and can cause movement problems. Now this is not available as a medicine right now, but it may be in the future. So if you do need this as a medicine in the future, you will need a TUE to use this. Next slide. Next, we look at the diuretics and masking agent category. Now, substances in this category can be abused by athletes to reduce their weight or to mask the detection of other substances. Now, new in this section of the list is a drug called torsemide. It is a prescription medication that might be prescribed for a medical condition such as heart failure or kidney disease. And because it's a diuretic, it's actually been prohibited for some time anyway, but it's now being added to the list as a specific example in this category. In the category of the list called manipulation of blood and blood components, voxelotor has been added, which is also a prescription medication used for sickle cell disease. This is a disease that affects red blood cells. The brand name for this drug is Oxbryta or Oxbryta. The drug reduces the breakdown of red blood cells, and this results in more red blood cells to carry oxygen throughout the body. And this greater oxygen may result in improved performance, and for this reason, it's banned. The next section with changes is the section called stimulants. Now, stimulants can reduce fatigue and increase alertness, and includes things like cocaine or amphetamines. Again, another prescription medicine has been added to this category for 2023, and it's called solriamfetol. And the brand name of this medicine is Sunosi. As a medication, it is used to promote wakefulness, and it's used for patients with excessive sleepiness, or also called narcolepsy. It can keep people awake for at least 9 hours, the manufacturers claim. So because of these stimulant properties, it's now banned in sport. Also newly listed in the stimulant section is a substance called dimethylamylamine, or DMAA for short. Now, these are other names for methylhexanamine related substances, which already have been on the list for some time. Now, it's extremely important to note that these are found in some supplements. You can see some examples on the screen. Sometimes they're sold as energy boosting supplements, sometimes as weight loss supplements. Sometimes they're claimed that it's an ingredient of geranium plants. Now, as I said, there's some pictures of the supplements on the screen, but there are many others. So please take some time to check any supplements you are taking at the moment to see whether they contain these. Next slide. I want to make you aware of a change that's coming to the narcotics section of the list. Not next year, but on the 1st of January, 2024. This is tramadol. Now, this is documented to be misused by athletes, particularly in cycling, rugby, and football, but also in other sports. There are potential health risks as it can be an addictive drug, which can lead to dependence if taken over a period of time. Now, this is a common prescription medicine used completely legitimately for severe and painful sports or other injuries. And it's often carried by many team doctors to administer to athletes for pain, potentially in an emergency. Now, there's a 1-year delay before this is prohibited. Now, this will allow for athletes and medical professionals to prepare for this change. From 2024, a TUE will be required if this drug is used. And this is certainly something to flag up to the healthcare professionals working in sports teams or with athletes. Lastly, there's some changes to the sports listed in the beta blocker section. So beta blockers are already prohibited in some sports, as I mentioned, such as archery and shooting, because they may reduce tremor and steadiness. Now, for the World Underwater Federation, or CMAS sports, beta blockers will be prohibited both in and out of competition in all the sub-disciplines of free diving, spearfishing, and underwater target shooting. Next slide. And lastly, if you're an athlete competing in mini golf, beta blockers will be banned from January. So now is really the time to check everything you are taking. Make sure that there's no prohibited substances in any of the medications or supplements that you're currently on, so that you're ready for the 1st of January next year. Thank you. Back to you, Armando.
Thank you, Mark, for all of these useful tips. We look forward to joining us at the end for the Q&A. And let's move straight to our second main topic for today, Therapeutic Use Exemptions, or TUEs for short. For this, I would like to welcome back David, who, like Mark, will provide us with a brief overview of what TUEs are and how to apply for one. Over to you, David.
Thank you very much, Armando, and thank you, Mark, for that informative talk. So I know many of the athletes and athlete support personnel listening today may be familiar with the TUE system and indeed the international standard, but I'm also mindful that many of you may be new to the anti-doping world. So today I'm going to take you on give you a quick overview of the whole system, highlight some key points, and indicate some of the changes that we've made that are relevant to you. Similar to the ISTI, some of the changes that have been made have been more technical. So I will just kind of focus on the ones that are more relevant to the athletes. So next slide. And we can go to the next slide again. So starting off, what is a TUE? A TUE is a special permission granted by an anti-doping organization to an athlete, allowing them to use a prohibited substance as long as there is a legitimate medical need. TUEs are only granted by anti-doping organizations following a robust review process. This process, protecting all clean athletes, promotes competition on a level playing field and upholds a fundamental principle of sport, which is inclusion. And next slide, please. So how do you know if you need a TUE? First thing is always be informed. Be informed and check your medication that you're using. Speak with the professionals. Speak with your physician anytime you go to see them. Also, you can go on the WADA website, check the prohibited list. As Mark alluded to earlier on, there are some very good drug databases available, such as GloboDraw. And again, speak to your national anti-doping organization, who should be able to signpost you in the right direction. If you don't know a sports physician, and if you are just going to your local general practitioner, always inform them that you are an athlete and subject to anti-doping rules, and they will be able to help you. And a quick tip as well, be careful of combination medications. These are ones that we often see athletes getting confused by and in leading to mistakes, especially combination diuretics, which are often used for blood pressure treatment. These are, so be very careful, read all the ingredients on the box and make sure to check everything. Next slide. So which organizations should you apply to? you can apply to all your anti-doping organizations, such as international federations. These might include organizations like FIFA, UCI. If you're a national level athlete, you apply to your national anti-doping organization. These are the anti-doping organizations within your country, such as UCAD in the UK or USADA in the US. Or then if you're going to a major event like the Olympics, you can apply directly to them. These organizations should be your first port of call with any queries around anti-doping. Next slide. So what is WADA's role in all of this? WADA monitors and reviews TUEs granted by all ADOs. But always be mindful that, but as a regulatory body, WADA does not process the TUE applications. So you don't apply to WADA for a TUE. This is where you go back to your ADO. WADA also acts as the appeal body for certain TUE cases if there's a controversy. And next slide. So we're going to start with a quick poll question just to see make sure you're all not asleep yet. And given that the World Cup is happening at the moment, this is a football related question, or as my colleagues here in North America would say, well, forgive them for saying it, a soccer question. So in the sport of football, the highest percentage of TUEs were granted for what substance class in 2022? Was it stimulants, supplements, glucocorticoids, or anabolic steroids? And I'll just give you a few seconds to vote. And I'll give you another 5 seconds as the votes are coming in. Okay, so we've seen quite a spread, but I'm happy that most of you have got it right. The answer is glucocorticoids. The reason being, glucocorticoids are a potent anti-inflammatory agent that are used often in the treatment of musculoskeletal injuries, which we often see especially in football. Now, those of you who said supplements or anabolic steroids, just to point out that these are we rarely see applications for these. And just to remind you that you really need a legitimate medical condition to get a TUE. We'll speak more of this later. So next slide. So as previously mentioned, you apply to your anti-doping organization who will provide you with a TUE application form to download from their website, or as newly included in the ISTUE 2023, they may facilitate you to apply online via their online portal. So whether you're completing the application form online or completing the paper form, it's imperative that you do this in conjunction with your physician, who will help you with the process. So contact your physician, use the checklists. So what are the checklists? WADA has created a number of checklists which are available on the website for a number of different medical conditions. Either print these out or have them available on your phone when you go to see your physician, and they will guide your physician on what are the documents, what are the diagnostic tests that are required. And once you have all that collected, send the application to your anti-doping organization. Next slide. Okay, so once you submit the TUE to your anti-doping organization, what happens next? They will then send it to what is called a Therapeutic Use Exemption Committee. This is a panel of at least 3 doctors who will evaluate it, and based on the criteria established in the ISTI, decide whether the TUE will be granted or denied. So how will they decide on this? That you must, with your physician, provide them with enough information that they can make the diagnosis from that supporting medical evidence that you've provided. Okay, next slide. So here I'm just going to briefly just speak about this, because this is available in the ISTUE guidelines, and it will be available on these slides, which will be sent out to you after. But basically, it is just a summary of what we've spoke about in the last few slides, going through the whole life cycle of the TUE process. So you can catch up on this at a later date. Next slide. Okay, some 2 important points to remember here. All approved TUEs are valid only for a specific medication and a duration. So they will have an expiry date. It's always important to check when this expiry date is. If you need to continue using the medication after the TUE is expired, you must apply for a new TUE. So you will have to go through the process again, but often you might just need a little update from your physician. But always make sure to check with your ADO. Okay, next slide. So you're probably wondering, how do all ADOs, do they follow the same process? And how does this come about? Well, yes, they do. And they do this by following the rules that are established within the International Standard for Therapeutic Use Exemptions. This harmonizes all the rules and regulations across all sports for all countries. Next slide. So what are the key criteria for granting a TUE? We have 4 key criteria that the panel of 3 physicians will deliberate upon, looking at your medical evidence, and decide whether the TUE should be granted or not. In the new ISTUE coming into force on the 1st of January, we've made a slight modification to the 4.0, but none of these 4 criteria were changed in any way. There was just a reshuffling to make it provide more clarity, but the key criteria have not changed. So next slide. So Mark, you might have heard Mark mention retroactive TUEs earlier on. Well, what is a retroactive TUE? This is one thing that we have updated, that we've clarified in the new ISTUE 2023 as well, where we've created a new definition, or well, we've clarified what it was. So a retroactive TUE provides an athlete the opportunity to apply for a TUE after using the prohibited substance or method. And we've also clarified that fulfillment of one of these criteria does not necessarily mean that a TUE will be granted. It just allows you to apply for a TUE. Remember, the 4 key criteria on the previous slide will still need to be fulfilled. So next slide. And a quick warning is, permitted does not mean legal, and legal does not mean permitted in sport. A prohibited substance is an anti-doping term. Please do not confuse this with national or other rules that refer to the regulation of the legal status of medications. So if you're going through an airport and you have your TUE certificate, it's not a golden ticket to bring whatever you want into every country. Make sure and check the rules of every country that you visit. Next slide. Okay, so if you're still with me now, we'll do one more poll question. This time, it's more of a prevalence question to give you an idea of how many athletes around the world have TUEs and how common they are. So the percentage of athletes competing with a TUE at the Olympic Games from 2010 to 2018 was, so this is over a period of 5 games. Was it less than 1%? Was it 5%, 10%, or 15%? Remember, at an Olympic Games, especially summer games, it can be anywhere between 10 to 15,000 athletes. So this is a large number of athletes as well. So I'll give you another 10 seconds. Okay, I can see the votes coming in. Okay, so this is an interesting one. So the correct answer was actually less than 1% of athletes. So less than 1% of these elite athletes at the games held a TUE. So I see a lot of you have gone for middle of the range, I guess. If you put something in the middle, 10% people will go for it. But that's just to give you an idea. They're not that common. So just to be aware of that. We can go to the next slide. Okay, so this is just to give you a bit of background of what happened in this for this ISTUE revision. So the ISTUE went under a minor revision following comments and suggestions received from our stakeholders, as well as input from the WADA TUE expert advisory group. Furthermore, it was necessary for the standard to be compatible with a new TUE module of WADA's anti-doping administrative and management system, ADAMS. I'm sure some of you have used it already, but just to inform you that we will have a new TUE module coming out hopefully in 2023. An ISTUE drafting team consisting of internal and external medical and legal experts provided a draft for a global consultation with stakeholders. This was undertaken over 6 weeks, and we received over 106 comments from 27 stakeholders. So based on the feedback we received from all the stakeholders, we implemented the changes. So next slide, please. So finally, just going to do a quick overview of the changes. Obviously, as I mentioned, it's similar to the IST. Some are very nuanced and technical, but I've tried to highlight the ones as I went through the process that would be relevant to you, the athletes and the athlete support personnel. So there was a slight restructuring of Article 4 to provide more clarity. We really separated out what is a prospective and what is a retroactive TUE, tried to provide more guidance in the definition of a retroactive TUE and the rules regarding when one will be granted or not. The introduction of the new online TUE applications for that, facilitating that for different ADOs. And then there was a clarification of the recognition process. This again would be a little more technical, but this mainly for ADOs. But I will, if there are any questions on this, I'm sure you can just email me. But that was it from me. So thank you very much.
Thank you, David, for presenting all this information in such an easily digestible manner for our audience. We have a couple of quick points to run through, and then we will welcome you back for our live Q&A. And before we move to our Q&A, I would like to emphasize that as you will receive this presentation by email, we have included a resources slide for your reference. The resources on your screen include links to further useful reading and other webinars. For example, we touched on supplements today, and if you would like to find out more information, there are a couple of ITA webinars that you can watch again, where we go through making informed decision-making about supplements use. We have also included links to a number of WADA resources, including summaries of the various modifications that we have discussed today. So let's move to our live audience questions now. And I would like to ask Mark and David to put their cameras back on. Welcome back, Mark and David, and we'll go with our questions. Our first question is from Adson. And the question is stem cell therapy considered gen doping? What do you think about this question, perhaps, Mark?
Okay, so WADA has issued some guidance around the use of stem cell treatment. And they say, and I quote from the WADA website, non-transformed stem cells when used alone, now that means with no additional growth factors or any other hormones added to that preparation, when they're used for healing injuries, they're not prohibited, as long as they return the functioning of the affected area to normal and do not enhance it. So if you want to refer to that, that's on the World Anti-Doping Agency website under the frequently asked questions section, along with a lot of other really interesting points relating to a lot of common medicines. So that's the status of stem cell treatment.
Thank you, Mark. The next question coming up is also for you. And the question is tramadol prohibited from January 1st, 2023. What do you think about this question?
So no, there's going to be no changes to the current status of tramadol until the 1st of January 2024. So this gives, as I mentioned, this drug is in very common use by a lot of doctors for the treatment of pain in athletes. So this extra year, WADA is saying that this gives some extra time really for medical teams to really, assess what medications they use for the treatment of pain, and to also educate athletes, educate healthcare professionals that from the 1st of January 2024, that a TUE will be needed if tramadol is used. So it just gives the whole community a bit of time to kind of digest this and think about how it affects them in practice and adjust their practices, accordingly.
Thank you, Mark. And our question is from Maria, and it says, hello, I would like to know in regards to prohibited substances in terms of cannabinoids. Is there a procedure for athletes to consume CBD? What do you think about this question? Or perhaps, David, if you would like to share your thoughts as well.
I'm happy to take this one as well. Again, there's some really good information on the WADA website under the frequently asked questions of the prohibited list on this particular topic. CBD, it's not prohibited. But WADA also states that athletes should be aware that some CBD oils and tinctures extracted from the cannabis plant may also contain THC, which is a prohibited substance, and potentially other prohibited cannabinoids that could result in a positive test. So, so CBD on its own is not prohibited, but sometimes these supplements are, potentially created in unregulated ways, or the manufacturing process may not be as strict as in one setting as others. And so this THC may be found in very small quantities, potentially in some of these products that actually, are sold as just CBD. So I guess the advice to athletes, really check the manufacturers of your CBD products. Some of them do present, the levels of THC that they guarantee are in their particular products. But it certainly is something to talk to your healthcare professional about and get some really good advice about using, products that are manufactured safely and are very sort of trusted. But again, please refer to the WADA website. There's some really good information about CBD.
Thank you, Mark. And following on your last advice, maybe for David, what resources would you recommend the athletes if they want to find out more about TUEs?
It's very similar to Mark's kind of answer. On the WADA website, there is all the information that you can want about TUEs. We also have the ADEL learning platform, with specific athlete courses that they can follow, especially for if you're a new athlete coming in. There's a wide range of resources available there. If you're looking for more information on the ISTUE, we're going to be publishing at the ISTUE guidelines, the updated version, which will be coming out at the start of December. This is going to include all the new changes, but it's also expanding on what currently we have there, providing more clarity. There's more examples. We have example cases. It's a very useful tool for everyone to use.
Thank you, David. Maybe another question for Mark. Mark, going back to today's topic, I would say that there's a lot to think about when we say medications. What will be your top tips for all the athletes that join us today for this session?
I think certainly just check every medication, every new medication that you may be prescribed or that you're considering purchasing from a pharmacy. And always just check the small print on a box. You'll see the ingredients listed, and just check those ingredients against the prohibited list or some of those resources that I spoke about before, globaldro.com. But also on the Global Dro site, there's links to a number of other resources in different countries where you can actually check the medicines that you purchase in your own country. So check and double check, really, especially when it comes to medications.
Thank you, Mark, for that answer. And we have a lot of questions coming in, so please stay with me. The next question is alcohol prohibited for individual sports? What do you think about this question, Mark?
Sure. Now, alcohol used to be on the WADA list of prohibited substances and methods. It was recently taken off in the last year or two. So it's no longer prohibited by WADA. However, there are some sports that prohibit alcohol under the rules of their sport. And that is because it represents a safety risk for their sport. For example, motorsports, alcohol is prohibited under the rules of that particular sports federation. I think if in terms of an athlete, I think you need to fully understand and all the substances and methods that are on the prohibited list, but also please talk to your international or your sports federation to check whether there's any other rules particular to your sport, where there may be other substances that are prohibited. So alcohol is one. Currently, tramadol is prohibited under the rules of the cycling sport. But as I mentioned, as of the 1st of January 2024, tramadol would be prohibited in all sports. So please do talk to your federations and make sure that you look at the current rules of your sport for some of these specificities.
Thank you, Mark, for such a very good answer. The next question is for David, and this is from Dr. Weil. And it says, good afternoon, sir. TUEs from international federations should be submitted through ADAMS. What do you think about this question, David?
Yeah, I was actually just typing an answer to him. Indeed, yeah, that you're very correct. And let me clarify that all TUE applications must be entered in ADAMS. Currently, the way things work at the moment, there's less than 5% of athletes who will complete the application themselves in the ADAMS system. The way it works is the athlete will fill out the paper form and send it to their ADO, who then has to transfer the information into the ADAMS system. So what we're hoping to do is to streamline this process, and we will have hopefully the ADAMS system where the athlete can go on and fill up the information directly into there, removing the two-step process. Or in other cases where some ADOs already have a kind of an online system set up where the athlete will go through a portal. They have to fill up so many different kind of categories to make sure that they need to apply. And then if this is compatible with the ADAMS system, that the information can be transferred directly. This way, it'll streamline the whole process. So hopefully, this is something that we are looking to do in the future. But he is correct in fact that yes, all TUEs must be entered in ADAMS.
Thank you, David. And just following up with your answer, we have another question about TUEs. And the question is, if an athlete submits a retroactive TUE under Article 4.3, I would say fairness grounds, does the TUE committee have any input as to whether the retroactive TUE gets granted under fairness grounds? Or is that solely the results management authority's decision?
No. This is a very good question, because the ISTUE fairness applications are ones because they're very challenging cases, and they're ones that generate a lot of questions. Within the article itself, it does say that the 4.2 conditions, which are the medical kind of conditions, are a consideration that must be taken into account. So we do recommend that all of these applications, that you do have a member of your TUEC involved in the decision-making process. In some cases, these cases can be, they can vary. Some can be heavily legal, whether the athlete is allowed to apply retroactively, or some can be very heavy medical. They can be more about the medical file. So they're a combination of both. So we always encourage that you have a mix of both medical experts and legal experts, because it is a fundamental thing to really take into consideration is, does the athlete have the medical condition? So, and just on this note as well, in the new ISTUE guidelines, as I mentioned earlier, that are going to be published in the next month, we're expanding even more and providing more guidance to ADOs on how to evaluate these applications. We're creating a step-by-step process for them to follow and how to send them into WADA, etc. Okay.
Thank you, David. And we have one more about TUEs, and this question is from Andre. And the question is, who is responsible to set the expiry date of a TUE? The same ADO that granted the TUE or another body?
Okay, so this again, this can vary in this case by case from ADO to ADO, but generally it will be the TUEC who are deliberating on the application who would set the expiry date. But in the case sometimes with retroactive TUEs, they may need to consult with the ADO who may know better about when is it covering the EAF or how far back are they going, because often your TUEC will only evaluate the medical information. So again, this is where communication comes in, a communication between the TUEC and the ADO manager and even the legal team to decide what is or in some cases only the legal team, but it would be generally the TUE manager in conjunction with the TUEC. The question about whether a NADO or whether an athlete is having two TUEs there with two different durations for the same medication, that isn't possible, because in accordance with one of Article 6.2 in the ISTUE, an athlete cannot have a TUE for the same medical condition at the same time. For the same substance, same medical condition, you can only have one TUE. This is to stop athletes from shopping around to different ADOs for TUEs. So if I think the question might be then is, if you have a national level TUE and it's for 2 years going forward, if your international federation recognizes it, they recognize it for the full duration. This is something that we clarified in the new ISTUE, but I thought it was more of a technical kind of questions that maybe athletes wouldn't know, but it's good that we're addressing it now. So when an international federation recognizes it, they must recognize it for that full duration until it expires.
Thank you very much, David. And we have time for just one more question, and this question is for Mark. Can all drugs be detected by dried blood spot method? What do you think about this question, Mark?
I think many of these drugs can. So the dried blood spot as a technique for testing is a very new technique, but I think it is a blood. It's the same as collecting blood. So all of those drugs that are usually detected through a blood sample that would traditionally be collected, through collecting a sample of blood, can still be tested through the blood that is provided on a dry blood spot. So the aim is really to test the full set of drugs that a blood test would normally that you would normally conduct on a blood test, but it's obviously using a much smaller amount of blood as a drop on a particular device.
Thank you, Mark. And for the audience, if you still have questions or if anything wasn't answered today, please, you can always reach us at education@ita.sport. And talking about the questions, we would like to invite you to our December webinar, which is a little bit different compared to our usual monthly editions. Next month, we will be joined by 3 Olympians who will be on hand to answer all of your anti-doping questions. And all 3 Olympians, our guests, have significant anti-doping knowledge of all of your questions. And maybe if you were thinking about some names, I'm talking about, yes, Nikki Hamblin, who is also part of the education team, Mikkel Thomas, and Anna Jelzik. And the idea is to ask your questions in advance and in a very anonymously way. So if there is something that you are not comfortable with and asking to your federation, to your NADO, or to your doctor, this is the moment where you can do it. For more information, please scan the QR code, and we hope to see many of you during the next session. And this wraps up today's webinar. A big thank you to David and Mark. And of course, a big thank you to you, the audience, for your attention, for your time, and for your active participation. We hope that you find this session valuable and interesting. After the webinar ends, you will receive a link to our survey along with the presentation slides. We ask you to please take a few minutes so we can improve our services. Thank you all once, and see you next month.
Thank you very much.